Well, did you know that people with diabetes in particular are at an increased risk for complications if they do contract COVID-19? Monique Gladden is with Buckeye Health Plan, and she is the Director of Care Management. She's joining us right now on the phone to explain that certain steps need to be taken, we understand, Monique, to really try to manage diabetes during this time. Hi.
Hi, yes, there are.
So can you run through us, Monique, what people need to be especially mindful of? Because this is one of those pre-existing conditions that throughout the pandemic has really been put out at the forefront of being problematic.
Yes, it has been extremely problematic. Studies from the CDC show that more than 75% of people that have died from COVID-19, they all had at least one pre-existing condition, and diabetes was the underlying condition in about 40% of COVID-19 patients. So it's definitely extremely serious. There are lots of precautions that any individual with a pre-existing condition should take, specifically diabetes. What I would implore is that anyone that has diabetes continue to manage their diabetes well. It's more important now than it's ever been. It enhances your immune system. So by continuing to take your diabetes pills and insulin, to continue to be diligent in testing your blood sugar and keeping track of the results, having at least a 30-day supply of medication is extremely important. And then making sure that you get your annual wellness visit so that they're able to do things such as check your feet, things like that that are very important when you have diabetes. And then you're always implored to call your doctor if you have any concerns about feeling sick. And then making sure that, you definitely take on all the precautions that everyone should be taking related to COVID-19, like washing your hands throughout the day, making sure you're not touching your eyes and nose and mouth, making sure you're cleaning your areas often, keeping that social distance at 6 feet from others, and wearing your mask, and then staying home if you feel sick.
Well, question for you, Monique. With all that considered, if your diabetes is well managed, will this make a meaningful difference in the outcome in terms of your prognosis if you do happen to contract COVID-19? Because a lot of times that's what we hear. You may have a pre-existing heart condition, but as long as you're on the medication, that really protects you. What do you say to that in regards to diabetes specifically?
Right. In relation to diabetes specifically, you're putting your best foot forward to definitely manage your condition the best way you can, and it can change your prognosis. If you don't manage your condition, it weakens your immune system, and then your body is fighting to manage that condition and deal with the fact of an unmanaged condition, and while attempting to fight a virus. So you want to be good to your body, do the best you can by making sure that you manage the condition well by taking your medications and doing all the things that we just talked about.
Great words of advice. Thank you so much.
You're welcome.